Module number 13, Water, Hydrotherapy. Water is the most ancient of all remedial agents for disease. The fact is made evident with frequent reference to its use in the earliest medical literature, as well as by the habits and customers of the ancient Assyrians and Egyptians, as brought to light by recent access and study of their records. Water is readily at hand and adaptive to almost any pathological condition. No other agent is capable of producing so great a variety of physiological effects, nor is any other agent so universally accessible. Hippocrates had an excellent understanding of the physiological properties of hot and cold water, which he used in treatment of fevers, ulcers, hemorrhages, and a variety of uses, both surgical and medical, that over thousands of years we've not improved upon. Romans developed the baths, which we've studied in Pompeii and Rome, where the baths were available to thousands of people and available hot, cold, vapor, and hot air. Hydrotherapy. Use of water in various forms and in various temperatures can produce different effects on different systems of the body. Many studies and reviews report the effects of hydrotherapy only on very few systems, and there is a lack of studies and reviews in reporting the evidence-based effects of hydrotherapy on various systems. According to proponents of hydrotherapy, cold water causes superficial blood vessels to constrict, moving blood flow away from the surface of the body to the organs. Hot water causes superficial blood vessels to dilate, activating sweat glands and removing waste from body tissues. Alternating hot and cold water is thought to decrease inflammation and stimulate circulation and lymphatic drainage. Hydrotherapy is often done at health centers, spas, or at home. Common types include Watsu, which is an aquatic massage where the therapist uses massage techniques while you float comfortably in a warm water pool. Sitz bath involves two adjacent tubs of water, one warm and one cool. You sit on one tub with your feet in the other and then alternate. Sitz baths are recommended for hemorrhoids, PMS, and menstrual problems. Warm water baths. Soak in warm water for up to 30 minutes depending on the condition. Epsom salts, mineral mud, aromatherapy oils, ginger, moor mud, and Dead Sea salts may be added. Steam bath or Turkish bath. Steam rooms are filled with warm, humid air. The steam is said to help the body release impurities. And sauna. The dry, warm air promotes sweating. Compresses. Towels are soaked in warm or cool water and then placed on a particular area of the body. Cool compresses reduce inflammation and swelling, while warm compresses promote blood flow and ease stiff and sore muscles. Wraps. While lying down, cold, wet flannel sheets are used to wrap the body. The person is then covered with dry towels and then blankets. The body warms up in response and dries the wet sheets. It's used for colds, skin disorders, and muscle pain. Contrast hydrotherapy. At the end of a shower, turn the temperature down to a level you can comfortably tolerate. It shouldn't be icy cold. Turn the water off after 30 seconds. Some people alternate between warm and cool water for up to 3 cycles, always ending with cool water. Warming socks. Take a pair of wet cotton socks, wet them thoroughly, wring them out, and put them on your feet. Then put on a dry pair of wool socks over them and go to bed. Remove them in the morning. The cold, wet socks are said to improve circulation in the body and help ease upper body congestion. Hot fomentation. For treatment of acute conditions such as chest colds and coughs, that is said to relieve symptoms but also decrease the length of the illness. And hydrotherapy pool exercises. Exercising in a warm water pool. The warm water allows you to exercise without fighting gravity and offers gentle resistance. It's considered helpful for back pain, arthritis, and other musculoskeletal conditions. Unlike water aerobics, hydrotherapy exercises tend to be slow and controlled, and often done under the guidance of a physiotherapist. Here's a look at several findings from the available research on the potential health benefits of hydrotherapy. Osteoarthritis. In a study published in Clinical Rehabilitation in 2018, researchers compared the effectiveness of twice-weekly individual aquatic exercise sessions to a once-a-week group patient education in people with knee osteoarthritis. After the 8-week treatment period, those doing the aquatic exercises had improved pain and function. For a report published in the Cochrane Database of Systematic Reviews, researchers analyzed previously published studies, including a total of 1,190 participants, on the effects of aquatic exercise in people with knee or hip osteoarthritis. They found that aquatic exercise may cause a small, short-term improvement in pain, disability, and quality of life. Recovery after athletic activity. Cold water immersion and contrast water therapy may help with certain aspects of recovery after team sports, according to a report published in the Journal of Strength and Conditioning Research in 2017. For this report, researchers analyzed previously published studies and found that cold water immersion was beneficial for neuromuscular recovery and fatigue 24 hours following team sports. Rheumatoid arthritis. Hydrotherapy with conventional drugs may have antioxidant and anti-inflammatory effects, according to a study published in the International Journal of Rheumatoid Diseases in 2017. For this study, participants with rheumatoid arthritis received hydrotherapy with conventional medication or conventional medication alone for 12 weeks. At the study's end, the group receiving hydrotherapy had an improvement in antioxidant levels and oxidative stress. Hydrotherapy may not be appropriate in certain circumstances. Cardiovascular disease or high blood pressure, increased blood flow may put additional stress on the heart. Fever, inflammation, warming may not be recommended for acute injuries, kidney disease, cancer, pregnancy, and decreased sensitivity to hot and or cold. It's a good idea to check with your healthcare provider before using hydrotherapy. Keep in mind that this hydrotherapy shouldn't be used as a substitute for standard care in the treatment of any health condition. Hydrotherapy is one of the natural treatments that is most widely accepted by the scientific, medical, and alternative health community as a whole. You're probably already using or have used some form of hydrotherapy at home or by a professional. Learning more about alternatives and uses may make this an easy addition to your current wellness regimen. Daily practices. We sing in the shower, think in the shower, and we even get clean in the shower. Taking a cold shower sounds like torture. Men are even told to take cold showers to lower their libido. In spite of all that, there are many who practice cold showers daily. Anthony Robbins recommends daily cold showers to power up. Cold morning showers are considered a productivity tool by many high-powered executives. Cold water is used for weight loss, skin, glossy hair, and is recommended strongly to alleviate headaches after long hot saunas. At Sanoviv Medical School, there is a hydrotherapy practice where you rotate from warm pool to hot pool to freezing cold pool. It's very invigorating. After the hot sauna, there's a quick dip in the ice-cold pool to ensure no one leaves with a headache. You don't have to stay in the cold for long. Start out at seconds and build it up a little. Water therapy has had a lot of studies, and there are many fun ways to bring water into our daily lives. Internal hydrotherapy. Colon cleansing is normally used as preparation for medical procedures such as colonoscopy. However, some alternative medicine practitioners offer colon cleaning for other purposes such as detoxification. Colon cleansing, also called a colonic or colonic irrigation, for such purposes isn't necessary. That's because your digestive system and bowel already eliminate waste material and bacteria from your body. During a colon cleanse, large amounts of water, sometimes up to 16 gallons, and possibly other substances such as herbs or coffee, are flushed through the colon. This is done using a tube that's inserted into the rectum. In some cases, smaller amounts of water are used and are left to sit in the colon for a short period of time before being removed. Proponents of colon cleansing believe that toxins from your gastrointestinal tract can cause a variety of health problems such as arthritis and high blood pressure. They believe that cleansing improves health by removing toxins, boosting your energy, and enhancing your immune system. However, there's no evidence that colon cleansing produces these effects or is beneficial at all. And colon cleansing can sometimes be harmful. In fact, coffee enemas, sometimes used in colon cleansing, have been linked to several deaths. Colon cleansing can also cause less serious side effects, such as cramping, bloating, diarrhea, nausea, and vomiting. Other potential concerns with colon cleansing include dehydration, a tear or perforation in the rectum, infection, and a change in your electrolyte balance, which can be dangerous if you have kidney or heart disease or other health problems. If you choose to try colon cleansing, try these precautions. Check with your conventional medical provider first, especially if you take any medications or have any health problems, such as kidney or heart disease. Make sure your colon cleansing practitioner is reputable and uses disposable equipment that hasn't been previously used. Get a list of specific herbal ingredients and amounts in the products that you use. Some ingredients can cause health problems.